Hey everybody, John Schumacher here with NewWaveHealthcare.com, and today I'm hanging out with Gina Lujan, who is the CEO and founder of HackerCare, a community organization that provides members benefits and healthcare coverage for the health technology and tech industry and all those folks who are hacking our wonderful tech industry. So Gina's been kind enough to come on and talk a little bit about HackerCare today. So, Gina, let's just have you start off. Just tell us a little bit about you personally, and then we'll jump into HackerCare.
I'm from, basically, I live in Sacramento, California. I spent about 3 years in the Bay Area. I spent most of my life in Sacramento. Spent 3 years in the Bay Area, opened a co-working space there, and from opening the co-working space, I kind of got like the startup and tech fever. I've always been an entrepreneur, but knew nothing about startups. So I fell in love with the startup community, ended up back in Sacramento, and myself and two other co-founders started Hacker Lab here, and Hacker Lab is a hacker and makerspace. We're the only makerspace in the region, and we're the only hackerspace in our region as well. So we've been on the forefront with other organizations and helping to ignite and foster the startup and tech community here. So that's what I do. I'm a mom of 6. Married, have a dog. I make things, and that's pretty much it.
Wow, mother of 6, you have to be busy. You have Hacker Lab, Hacker Care, and then a whole heck of a lot of kids. Wow,
yeah,
that's a busy girl.
Yeah, they're all grown. They're in their 20s. So I'm kind of at this point in my life where I have one at home. She's 15. The rest of them are grown. So I'm kind of at this point in my life where I'm having fun and kind of doing what I want. So
nice.
Neat.
Nice. So yeah, a lot of our audience that are in the health technology industry and might be curious to know about HackerCare. So can you hit us with your, I guess you'd call it an elevator pitch, or boil it way down for us and tell us what exactly you guys do at HackerCare?
So HackerCare is basically a members organization that offers healthcare coverage for hackers by hackers. We feel that the healthcare system is broken, and we're trying to find different ways to collaboratively change it, or at least make it as pleasant as possible. So we're trying to put together, which we already have, is a low-cost, affordable healthcare plan, as well as having other startups with their healthcare products offered to our members at a discounted price to kind of benefit or add an added plus to their healthcare plan. So instead of just having basic healthcare coverage, maybe we'll offer telemedicine from a startup that's maybe focusing on dermatology. So instead of going to the doctor or paying a high deductible to go see a doctor, you can have a discounted rate to go see a teledoctor. So we're trying to do different things like that. We're partnered with VSP, and we'll be offering some of their beta products to our users as well. So we're really focused on hacking healthcare by utilizing startup tools and services, as well as trying to offer a transparent health plan.
Right, perfect. So that's cool. You're hacking up healthcare there. That needs a little bit of that. And so, what are the key problems you guys are out to address? I mean, you mentioned there's some major inefficiencies in our healthcare industry. Can you name a few of those and how HackerCare addresses that?
Yeah. So, and we've kind of been kind of navigating our way and learning as we go. I have no healthcare background. And so one of the things that we have is we notice a lot of people have a lot of questions. Like when you go to a healthcare site, you're like, I don't know what I'm looking at. So we try to offer some type of concierge service. Our broker is available by phone and via email to answer all those questions that you may have. And so we're trying to offer a certain level of transparency. We're also trying to offer low-cost, affordable healthcare plan, as well by offering additional services to that plan. So yes, you're paying for your healthcare coverage, but maybe on the back end we have additional services that kind of offset that balance. Another thing is a high deductible. A lot of entrepreneurs aren't going to be able to afford to pay a low deductible plan. So how we're hacking it is that we're offering a share of cost deductible pool. So basically you have the option of paying in $10 to $15 a month, which goes into a pool. that money goes untouched. And if you get sick or one of your fellow members gets sick, you're able to go into that pool, and we're able to cover up to 80% of that deductible for you. So that allows you to keep your costs down while still offering you the benefit of being able to use those services.
Right, right. Yeah, I saw that on your website, that a co-op kind of
Yeah.
deductible thing. How does that work? Like, do you guys just take a piece of everybody's premium that they pay into the plan and put it into that, or can you tell
Um,
us about that?
yeah, so basically it's separate from your actual payment to the insurance carrier. It's a actual you sign up to be in the pool, and the money goes into an escrow account where we can pull it out if needed. And it's just basically a shared pool. So you have an option as to whether you want to pay for that or not.
Hmm.
And if you decide that that's something you want to do, then everybody does. And if you get sick or if somebody else gets sick, we pull from the pool. And if there isn't enough, if you don't have, if you haven't contributed enough or there isn't enough money, we'll say, hey guys, so and so broke their leg and we need $5,000, so we're going to ask for an additional $10 a month to help your fellow community member out. So it's kind of like I think it's a nice sharing way of taking care of one another.
Right, right, right. So talk a little bit about the differences between Hacker Care and like some of the other plans out there. I know a lot of people have, in California at least, have talked about covered California and
Yeah.
Obamacare and the rollouts and the changes that are coming with the policy changes there. But so let's say I'm a health tech startup guy and I'm really busy with my startup company, but I need coverage by law now.
Hmm.
What Can you touch on some of the differences as far as, what does Hacker Care give me that some of these other places wouldn't?
I think one of the main things is, first and foremost, is that I believe there's power in numbers. So I believe that the more that we, as a community, support Hacker Care, I think the number one thing is that eventually we'll have enough members that will be very powerful to be able to create our own plan or to be able to do some really unique things. So right now our main focus is just to get members to support what we're doing, so that way we can say, hey, look, we've got 1,000 members. We want to raise X amount of dollars so we can do this and get really innovative. So that's the number one thing, is community supporting community for this specific goal. Two, our rates are very competitive. We offer a PPO plan, which the rates are actually very good, and I'll put the link up. In comparison to Cover California, it's a pretty good rate, and so we're actually in the middle of trying to. We need 35 more members to actually lock in those rates.
Oh, I tried to help you out there a little bit. I posted a couple things for you, but
Yeah, we need 35 more,
yeah.
and we'll get them eventually. But we're trying to get people to avoid the tax penalty. So we have a deadline right now. But basically, the rates are actually very competitive. I think that the share of cost deductible pool is a very, very innovative and also very helpful thing. So I think that in itself, especially anybody who's choosing a plan on Cover California that picks a high deductible plan, I think this is a I want to say better, because we're not in competition with Cover California, but I think this is an alternative way to go to be able to save some money.
Hmm. Hmm. So as an entrepreneur, what inspired you to take on the healthcare industry and the Hacker Health company in particular? Can you touch on that?
It was a complete accident. As one of the co-founders of Hacker Lab, which we're a community-based organization, a physical hacker makerspace, we were actually concerned about our own members and what they were going to do for healthcare. So just kind of initially kind of looking into that, I was like, oh my God, what are we going to do? It's a huge problem, and we're a chapter of Hackers and Founders. We're Hackers and Founders Sacramento, and I'm really good friends with Laura and Jonathan. And so, I went and met with them, and I was like, this is a huge problem. And it's a joke, but it actually is true, that all of a sudden one day I was in Jonathan's email, Gina's in charge of health insurance. So I got dubbed the health insurance girl. And I was like, and Jonathan Nelson is so awesome, that when he says you're in charge of something, you're kind of in charge of something. So I go, okay, well, I guess I'm in charge. And so that's how that happened. And Hacker Care, once we started getting into it, and I actually met with the broker, who Kevin Grenz from Tab Insurance. Once I met with him, and we started talking about the business model and everything that's going to take to make this happen. I'm like, this is actually a business. This isn't a project. This is a full, like a almost a full-time business
Yeah.
because there's so many moving parts and it's such a huge responsibility. So it just all kind of happened on accident. That's why I don't know anything about health insurance and I'm kind of learning as I go.
Right. Yeah, we just took action on it and start learning. That's you can learn a lot in 6 months, if
Yeah,
you really put
exactly.
your head down and just rock it and have good people around you. So I'm sure you guys are doing great with that. Um, Touch on some of the companies that you guys have involved within your. So you guys have this network of members benefits that you've put together. Can
Yeah.
you touch on the types of services that someone could get, and also maybe a couple of the names they may recommend or recognize?
Yeah, so right now, one of them is VSP. They're our champion corporate sponsor, and they're our main sponsor and main supporter, and they're the world's largest eye care vision carrier. And then also iDoc24, and
Hmm.
they're telemedicine dermatologist. And then we're working actually on two more, but they're in stealth mode, so I can't announce their names. But there's two other. One's a telemedicine, and the other one's for kind of catastrophic illness.
Hmm.
So I can't bring them up. So currently we have one active, and then VSP, and then two in stealth mode, and we're actually looking for more. So if you're a healthcare startup and you think that your services would benefit the hacker care community, reach out to me.
Definitely, yeah. Yeah, we'll definitely link up your stuff at the bottom of the show notes page, and I have some
Thanks.
connections, I guarantee, in the telehealth industry in particular that might be a good fit. So, um, yeah. So let's see here. What's the vision for Hacker Care? Like, let's look down the road a little ways. Where would you like to take this as far as size of it, services offered? Touch on that.
Well, so I had a meeting with Jeremy from Nextbase, and he was talking about, how big do you want this to be? I'm like, actually, I think this could be really big. And he's like, yeah, I think so. And he said that by 2020, um, there will be 60 million freelancers across the country. So
Wow.
I think that we're in at a good time, and I think the possibilities are huge. I would. It's a little advantageous of me, but I think it would be cool. And we're kind of shooting for 5,000 members across the country, and all from the hacker and tech community to be members of Hacker Care. And then our really big pie in the sky is to eventually have a captive and be self-insured. But that's once we're to thousands of members, it's something that we would like to look at.
Right. So is this going to be your primary baby then? Is this going to be your focus? Or are you going to be, obviously you're doing Hacker Lab
I
still.
think Hacker Lab, yeah. So Hacker Lab is, I'm kind of juggling between both. So they're both my babies right now.
You got twins.
Yes, I have twins. Yes, twinsies. Yes.
Yep. So let's see here. What's the biggest challenge that you faced creating and starting this company, Hacker Care? Can you talk about that?
The biggest challenge is one, I don't know anything about healthcare. So that's like super, super huge. It's like I don't know anything about healthcare. Two is getting the initial it's kind of the chicken before the egg, because we need, in order to get those awesome rates that I'm talking about, we actually need 85 to 100 members to do so. Um, so we're short some members. So there's people enrolling, but they can't become active until we have that number. So it's kind of like that's been extremely challenging. So we're trying to encourage people right now to sign up for free. We've been giving out a specific link, and that we won't charge the annual membership fee, which is $50 a year, and that just helps for administrative costs until they're actually active.
Hmm.
So that's been a huge problem. Another problem is that the startup has been extremely delayed because of my personal life catastrophe and the house fire. So I
Hmm.
had a lot of people kind of a little upset because they couldn't get a hold of me. Um, but we're back and we're in full swing and trying to get it going. So
Right, right. How are you getting the word out on this?
we're reaching out. Right now we're using uh, the startup organizations that we know of and friends that we have in startup organizations. So I've reached out to Of course, we're a company that's incubated out of Hackers and Founders. So Hackers and Founders is helping us. PolitiHacks is helping the School Factory, which is it's basically the mothership for about I think 85 hacker spaces across the country. NextSpace is helping. Angel Hack has offered to step in and help. And so we're just going through various different channels to try to get the word out.
Right.
We have like no funding. This is like so it's like everything's like extremely bootstrapped and startups.
Right. So yeah, been using your existing network to help spread the word is always
Yes.
that's the best way to do it, right? I mean, you can
Yes.
post on social, you can try to do with all those things, but if you have an established network of people who can share your stuff and get the word out, boy, that really just explodes it. So
Yes.
sounds like that's what you're doing. Yep. All right. Well, Gina, thanks for coming on and sharing about Hacker Care today. Let's just, as we wrap things up, just tell our viewers where they can find out more about you and get more information about Hacker Care, and then we'll say goodbye.
Okay. Yeah, you can find us at www.hackercare.org, and you can email me at gina@hackercare.org as well.
Perfect. All right. Thanks, Gina, so much. Hope you guys enjoyed that discussion on Hacker Care today. If you are in the healthcare tech space, it looks like a good opportunity to check that out and see if that's a good fit for you. We'll have all the resources and websites and Gina's contact information linked up on the show notes page of this recording. So if you are listening to this on iTunes, go over to newwavehealthcare.com/hackercare to view the video recording and also get access to Gina's contact information and all the things mentioned during this conversation. If you are watching this on the newwavehealthcare.com website, go ahead and click on the sidebar banner that says Hear Us on iTunes and subscribe to us on iTunes. Leave us an honest review. We'd very much appreciate that so you can listen to these wonderfully informative interviews on the go. All right, everybody. I'll see you next time.
Bye.